Hello and welcome. My name is Dr. Schiestel and I would like to talk to you about SYSTOMED. What does it mean? What are we doing at SYSTOMED? What can we do for you? I am a medical doctor. I am specialized in orthopedic surgery. I'm specialized in trauma surgery and sports medicine. Now, SYSTOMED is an artificial word, same as Adidas or ASICS. It's combined of these words, systemic oriented medicine. Now, you might say, what does that mean? In order to give you an idea of the development of SYSTOMED, I have to tell you a little bit about my personal story. Well, I was trained as a resident for orthopedic surgery and trauma surgery, and I was very happy to do that. I was influenced strongly by my father, who was a trauma surgeon himself. So I felt dedicated from my early childhood on to help people in one or the other way to recover their strength, to get back to sports, to cure a fractured bone. I was fascinated by that from childhood on. Now, when I finished my studies and I started working at the beginning of the 90s, for me, surgery was the best way to cure a problem because I saw cruciate ligament ruptures, I saw fractured bones, I saw street trauma. And I was trained in that, I would say on a very high level. And I was happy to do it. I was good in doing it because I believed in this. I believed in healing with cold steel. Now, over the years, I came across different people, different accidents, different treatment options. And there were two experiences that really got my interest in understanding better how people heal, how accidents happen, and how people deal with accidents. Now, one day I had two patients with the same type of surgery, which was a very routine surgery. One of them was almost pain-free, and the other one was in severe pain. So it was very surprising for me why, for the same surgery, the same wound, the same post-operative management, one person was so much in pain and the other one not. So I started a little study by myself of about 120 people trying to find out what pain is like and why one person suffers more than another. And I got a very modern conclusion at the beginning of the 90s, matching with pain gate control theory, matching with all the things that I learned later on. But in fact, pain is something that you learn in early childhood. Because pain doesn't exist in your brain or in the periphery. It has to be developed and interpreted. So those people who suffer of very little pain for the same injury as somebody who is experiencing severe pain just have another program inside about how to deal with pain. Then the next thing, for a couple of years, I was responsible for a unit in the hospital that was taking care of patients who had an infection. And I learned very soon that these people have a quite different energy to others. They are special. So getting a wound infection is not only a matter of having a bad surgeon or having bad luck. Getting a wound infection, not always, but very likely, is built on the programs that run inside of you. Now that got my interest. And I was looking more deeply into all these complementary issues of medicine. I looked at TCM, I looked at energy work, I looked at different things that might have an influence on healing and on the way you deal with injuries or with accidents. So I came across a lot of different strategies, philosophies. I expand my wisdom and I find my solution in the word systemic oriented medicine. Now, what is a system? A system in my interpretation, is a group of elements that are united by a function. So the group of elements serve a special function or are able to have a special function that a single element cannot have. And they are defined as a group by this function. Now, when we look at our body, we have a digestive system, we have a cardiovascular system, we have a neural system, we have an immune system. These are many different elements that look completely different, but as a group, they serve a certain responsibility or a certain need. Now we have a lot of different systems. We have systems outside of us, which we would call nature. Now these systems are completely well adapted to our system. We can easily deal with these influences, with the planet system, the gravitation system, the magnetic system, the electromagnetic system, and all this stuff. We are developed into this. Evolution gave us the ability to deal with it in a very smooth and comfortable way. And then there are artificial systems that we created. The cultural system, the economic system, the law system, the transport system, and the belief systems. But most important of all of them, and this is my experience, is our family system. When we talked about a program inside of us and imprintment, but this is what comes to you by your family. You were still a single cell in the womb of your mother when this programming started. It's not about genes. Yes, genes have a very important influence on us. They make you tall or small, they make your bones in a certain way, or they make your tendons in a certain way. But still, that's only little in comparison to behavioral imprintment. And this is what you get by your environment, the environment you grow up in, your parents, your grandparents, your neighborhood, the culture you're growing up in. This has a direct influence on what you become and what your body looks like. Now, what has this to do with medicine? Very often people come and have a certain problem at a certain point, maybe the elbow, maybe the gut, maybe the knee. But it all is related to their inner and the outside systems. They influence each other all the time, if you're awake or if you sleep. It's always there. Yes, you can influence it somehow, but most of the time it just happens to you coincidentally and causes a reaction, maybe a chain reaction inside of you, sometimes with a very severe and unpleasant outcome like cancer, multiple sclerosis, or other diseases which are difficult to treat. Now, our experience at SYSTOMED is that if something becomes chronic, it's very likely that the origin is systemic. So it's not so much inside of you, it's much more in the systems surrounding you and the interaction between you and these systems. Now, we at SYSTOMED are focusing on all of this as good as we can. So we need a lot of time to talk to you, to find out who you are, what your systems are like, and how you are integrated in these systems. Because this might be responsible for a chronic disease. This might be responsible for the fact that you tear your cruciate ligament 3 times and not only once. This might be responsible for the fact that you don't heal properly, although everything was done well. Much more important than what we do is why we do it. We at SYSTOMED, we love to treat people. We love to find out, to investigate what is the reason, the real reason of your injury, accident, illness. And we take stands for a humanitarian medicine. We take stands for you as a patient not for the diagnosis and not for the results. We are looking at you and your system, your world, your being, in order to understand why you have this illness and this accident. And we give our best, all the empathy that we can give in order to understand you and understand the reason behind what you have. In our center, we mainly deal with orthopedic problems. So we mainly deal with the musculoskeletal system and also with nutrition and with psychosocial phenomena. Because in our experience, these are the three most important gateways in order to find out what happens inside of you, because it's the most common places where these inner blocks, these inner entanglements show up. In your physics, in your digestion, in your thinking and in your behavior. And this is where we spot it, we try to find the reason, and we try to repair or to restore it. In order to do so, we basically use traditional school medicine. And that's a very, very sophisticated, highly developed tool. I'm very thankful to all the people that investigated, that spent time, that made all these incredible inventions that make it so easy for us nowadays to cure people in traditional school medicine. And beside that, we have a lot of complementary stuff going on. We have TCM, traditional Chinese medicine, we have energy work, we have psychoneuroimmunology, we have acupuncture, we have nutrition, we have the microbiome investigations. That's all the little bugs that live inside of you that make you alive, that keep you alive. We need them, but that's another story. So we look at all of this and combine it in SYSTOMED. So SYSTOMED is not only the name for a practice or for a medical center, it's a name for a medical philosophy that serves the patient as a whole human. There is another important thing about systems. Of all these elements, a system is built out of. Even if one element is disturbed or missing, the whole system will show a change in his acting and behavior. And we can detect the missing or the disturbed or damaged element by looking at any of the other. That's the good thing. So even if you have a problem inside your gut, we can spot it in some other places in your body. Or if you have a problem in the bone, we might even spot it in the gut or in your behavior or so on. So these systems are connected. And this is what we use for diagnosing and for treatment. Because sometimes one spot cannot be addressed properly or extensively enough. So we can use the other connections of this system to make this part work again. Now, if you ask yourself, why should I go there, or what is the right thing to present them? Well, any kind of pain. Any kind of pain in your body or maybe in your psyche. We can deal with nutritional problems, we can deal with orthopedic problems, we can deal with psychosocial problems, because it's about you and your environment. And we, the group of doctors working here, are trained for looking at all these things. We work as a team, so we interact, we talk to each other, we communicate about our findings, and we take all our wisdom, we take all our experience in favor of you and present you a solution that's more than a single cut or surgery, that's more than a pill, that's more than a remedy. We treat the whole system with SYSTOMED. So I hope I could give you a short inside look about what SYSTOMED is like and what we do here. You're very welcome with every question you have. You're welcome with every pain you might feel, or, even more important, for prevention. Come here before it hurts. Come here if you have the feeling that something is not as it should be. You just don't know yet if there is a problem, but it feels unpleasant or it feels not right. We will try to investigate, we will try to consult, we will try to find out what's going on. My name is Dr. Schiestel. I'm talking here from the SYSTOMED Center in the 3rd District in Vienna. We are specialized on people, we are specialized on orthopedic problems, nutritional problems, psychosocial problems. And you will find us in the address that will be in play now.